अस्सलाम वालेकुम। गुड आफ्टरनून टू वन एंड ऑल। आज की इस वीडियो में हम बात करते हैं मैनेजमेंट ऑफ एयरवे ऑब्स्ट्रक्शन। अगर एयरवे ऑब्स्ट्रक्शन होता है यानी रेस्पिरेटरी ऑब्स्ट्रक्शन होता है तो उस वक्त हम कौन सा मैनेजमेंट करते हैं। सो करंटली आई एम डीलिंग विद द emergency nursing. So emergency management in nursing, how we are going to follow the emergency management if we get a case of airway obstruction. Let me talk about the severe respiratory obstruction या respiratory या airway obstruction. So in case of that, a patient, we may get a sign of choking. A patient, he will be choking. Choking is followed by difficulty in breathing. When the patient will be doing like this, understanding? So he'll be opening his mouth in need of the much more oxygen for his survival, for the normal respiration. So but even though he won't be able to get the oxygen, understand, the oxygen won't be delivered to the lungs. Why? Because of the obstruction. The obstruction can be in the upper airways, it can be in the lower airways. So in case of that, we are going to take an emergency management for the patient. Okay, so the first thing that is known as HEIMLICH maneuver. So what is HEIMLICH maneuver? HEIMLICH maneuver is an emergency technique or emergency method, or we can say emergency management in choking. When the patient is choking, when the patient is having the respiratory obstruction, because of that he will be having a difficulty in breathing. So that time we are going to initiate this technique. So what is HEIMLICH maneuver? It is a procedure. It is being performed by the healthcare provider in order to provide immediate management, immediate interventions to the patient in order to save his life, in order to in order to prevent the complications of the airway obstructions. The airway obstruction complication could be death also. When a patient is unable to take the oxygen, when there is the insufficient delivery of the oxygen towards the lungs, so the lung may collapse and patient may get death, patient may die, he may get the respiratory arrest. Because of that, he may get cardiac arrest. So as a result, patient may die. So in that, what we are going to do, we are going to follow the HEIMLICH maneuver. So when the patient is choking, what we are going to do, a person, a healthcare provider has to come just behind the person who is choking. First of all, he has to wrap his both the hands on the front of his chest, waist, understanding, so that he can feel comfortable, he can feel comfort in providing the HEIMLICH maneuver procedure or technique. So in that, the first and foremost step is that a person who is giving this HEIMLICH maneuver, he has to perform the fist, he has to make the fist, so like this, and he has to keep this fisted hand, understanding, beneath the rib cage, below the rib cage, understanding. So after that, what this healthcare provider is going to do, after that he is going to tightly grasp this hand, understanding, for this is the fist, and then he will take his dominant hand, his right hand, and he is going to sharply, or we can say he is going to tightly hold this hand. Then after that, what is the procedure? Then he has to make the upward thrust like this. For example, this is the, I will show you, I can show you. For example, if this is, for example, this is the patient, okay, and this is the provider, or this is the healthcare provider, he has to make the fist like this, okay, so like this, and then second hand, with the second hand he is going to, what is here, what he is going to do, he is going to tightly grasp this left hand, this fisted hand, and then he has to, what he is going to do, he has to pull the upward thrust like this, okay, like this is upward thrust, inward thrust, upward, inward. So what this will exactly do, when a healthcare provider is making the upward thrust, understanding, so this will make the food particles to come outside. If there is the upper airway obstruction, if there is anything is stuck inside the this one, what we can say, larynx or pharynx, so it will come out, and we may save patient's life, and patient may have the patient may recover normal breathing or airway passage. Okay, so that time what we are going to do, we are going to make the 5 times upward thrust, upward, inward, upward, but sharp, or fast, understanding. So if there is any problem, if there is any injury with the rib cage because of this thing, no problem, you just have to save the patient's life, that's it. Now if this does not work, then you have to go for the chest compressions, that is CPR. You have to make the chest compressions, you have to give the deep chest compressions, not below than 4 centimeter, sorry, 2 inch or 4 centimeter, understanding. So you have to give the 100 to 120 chest compressions per minute and 2 mouth to mouth breathing, which can initiate or which can reactivate the patient's airways, or we can say lungs, which can be able to function, understanding. So after that, if this is not working, then we have to take the AED, that's automatic, understanding, defibrillator. So this defibrillator will be giving the electrical shocks, understanding, in order to generate the electrical impulses in the heart, so in order to have a normal heart electrical activities of heart. So when there is a when there is a recovery of the this one circulation, so as a result, so their blood can go to the brain, and there is the we can say there the brain, we can save the patient's life. So we can do the Heimlich maneuver followed by the CPR, and then after that we are going to give the ALS, understanding. So advanced life support, BLS is the basic life support, that is CPR, that involves the chest compressions and the mouth to mouth breathing. If this is not working, and if the patient has got the cardiac, because of the respiratory arrest, he has got the cardiac arrest, I am telling the complication, so that time you need to perform AED, understanding, automatic defibrillation, which involves mainly the electrical shocks are being given, understanding, so that there may be the regeneration of the electrical impulses, which may generate the electrical activities of heart. Okay, so we can by this thing we can save the patient's life. Hope you understood. Thank you.